Good morning, Dr. Adam Friedman. Thank you for being here live on the Valder Beebe Show out of Dallas, Texas. How are you today?
I am great. Thanks for having me.
Well, I want my audience to know I will be speaking with Dr. Friedman. He is a professor and the chair of dermatology and serves as the director of the residency program. Boy, you got some titles on you, doctor.
I don't sleep much is what you're getting at.
You don't. You are working really, really hard, at Health and Science in Washington, D.C. We're going to start with I'm going to make it a little bit easier for my audience. What is CSU that we're going to be talking about since you deal with skin and skin diseases? What is CSU?
Yeah, great starting point. So CSU stands for chronic spontaneous urticaria, which is a chronic immune-driven condition that results in hives that can itch or burn, that will occur anywhere on the body. They keep on coming. And for roughly 30% of people can also have deeper swelling called angioedema. And I always tell my patients, think of that famous scene from the movie Hitch with Will Smith. That was angioedema. Now, the key things to remember about this condition in defining it are really three. First is when we say urticaria, we mean a single hive does not last longer than 24 hours. You can absolutely get more of them. One disappears and 15 more can come, but each one shouldn't last longer than a day. Then the chronic piece. That means that this has been going on for longer than 6 weeks. This separates it from acute urticaria, which I think a lot of people are more familiar with, whether it be from a medication or from a food. This is totally different. Then the last piece, which kind of speaks to that, is that there is no root cause. There is no underlying thing that drives this condition. This is not an allergy. It's not an infection. And along those lines, there's no lab test. There's no skin biopsy that will diagnose. This is a clinical diagnosis. And I think therein lies the challenge. Because of that, I think that leads to delays in diagnosis. We know it could be as long as 2 years from the time it starts to the time that someone actually gets that name to a face, which obviously will add to the burden of disease.
I'm going to take one from, where is this coming from? My audience on multiple platforms. This one coming from Facebook. They say that, They say a long time ago on the Valder Beebe Show, I heard Vicki Lawrence talking about her having CSU. Is this common in America?
Yes, it is. So the easiest way to remember, 1% of the U.S. population, 1% of the global population. So in the U.S., we're talking about 1.7 million people affected with this. Just like many chronic skin diseases, it does not discriminate. It can affect all demographics. However, we do know it tends to affect women more than men and usually will manifest between the ages of 20 and 40. So you can imagine that's a time when people are just getting started, starting a career, a family. Throw in recurring hives or angioedema, not a good situation. I think one of the most unique things about this condition, though, is the spontaneity. The fact that you could be having dinner with friends, you could be at work, you could be enjoying a lovely radio interview, and all of a sudden head to toe covered with these things. And I think that's very unique to CSU, and that's why I've partnered with Novartis to raise awareness about this condition, and also to talk about that there is help out there and how to go get it.
Okay, there is help. But before we get to the help, are there triggers or are there reasons for you all of a sudden having this condition?
Yeah, I appreciate that question because by definition, there aren't. So in terms of when we think of acute urticaria, which is very common, short-lived, a couple bouts, that sometimes we can find the cause. If we look in the literature, it's between 20 to 80% of the time. That's a wide range where it might be one of three things: food, medication, or infection. CSU, not the case. There is no underlying driver. And in terms of triggers, being a chronic inflammatory skin disease, it's kind of a lame response, but overall wellness is important. For example, sleep, exercise, eating well. Doing the opposite of that can worsen a chronic inflammatory disease. But with CSU, there's not one thing. That would be wonderful if there was, but unfortunately, there is not that direct linear correlation.
Okay, and you said there's a high propensity for women. I figure we just know that, but we don't know why.
We do not know why, unfortunately.
Okay, so let's talk about the cure or the fix or the help. Which one is it? Do you guys have a cure for it? Which one?
Maybe one day. So like so many of the conditions we treat, it's about management versus curing. So first line out of the gate for CSU, we're looking at non-sedating second generation antihistamines. What a lot of people don't know is that based on the guidelines, you can go up to 4 times the recommended dose on the bottle. Good news is about 50% of people will respond and they will be able to control the condition, keeping it at bay. But that also means 50% of people cannot get under control that way. Now, I'm not trying to be a pessimist here. I'm here to actually offer hope in that there are now 3 FDA-approved medications that are approved for people who do not respond to antihistamines. The most recent one, an oral selective medication, was literally just approved like about a week or so ago called Rhapsido or remibrutinib. This is approved for adults with CSU who do not get clearance, do not get relief from antihistamines. It is only approved for this form of urticaria, CSU, and it's currently not approved for children. You know, it's so interesting these days where I'm talking to a patient about a new treatment, and historically it'd be like, oh, well, how does it work? How well does it work? Now the first question is it safe? And I think it's worth talking about safety. So for remibrutinib, the thing we talk about the most is going to be the increased risk for bruising or bleeding. And why this is important, if someone has a bleeding disorder, there are medicines that will prolong bleeding like anticoagulants, or they're about to have surgery, this is something you gotta talk to your healthcare practitioner about. Other side effects include headache, sore throat, runny nose or congestion, as well as stomach pain and nausea. And that's a handful. You know, for someone who's really interested, you can get all the information and more at www.rhapsido.com.
Dr. Friedman, I want to thank you for the research that you're doing on this, because the number of people that you say are affected by this is just astounding. So someone has to help them live with this or find some answers. But I want to thank you for sharing what you know and the methods that you have for us dealing with this. Thank you for being my guest on the Valder Beebe Show. I truly appreciate it.
Oh, thank you so much. I appreciate it as well.
Hi, I'm Valder Beebe, host of The Valder Beebe Show. We have over 1,000 videos on ValderBeebeShow.com and YouTube.com/Valder Beebe Show. We upload new videos daily. Our site is a modern baby boomer platform with news and information important to boomers. Subscribe to youtube.com/Valder Beebe Show and stay connected as I interview the world's most fascinating people.